So in learning outcome 3, hi Christine, you've joined now, so that's great. We have just about started. So when we look at, the learning outcome 3 in general, we are looking at understanding the provision. In the first learning outcome, we have understood what is social and community welfare, why it was introduced, why is it important to the NHS, what are the factors which has contributed to the creation of this concept. Now, in the third learning outcome, the focus is on the provision. What do you mean by the word provision? Provision, sometimes, we use, like I mentioned, sometimes we use the word provisional driving license, you get provisional grades, provisions, sometimes you do provisioning at home. That means you are basically creating allocation or, providing for certain things which are required in terms of money, budget, allocation, food, supplies. So when we talk about provision is basically providing for. Now, when we look at the word provision and the inclusion of this word provision with healthcare, what do we mean by this? When we talk about provision or healthcare provision in general, that means the government is looking at providing various services under health and social care in terms of various areas of health and social care. And they could be inpatient, outpatient care, it could be rehabilitation, it could be nursing services, it could be prescribed medication, it could be remedies or, some sort of medical aid equipment which is provided to people after, if they are recovering from, say, any sort of incident or, illness. And in some cases, even in terms of costs that are required to be footed by the government in terms of the National Health Service, things like transportation. One of the examples in terms of provision would be the government has to provision for budgeting for A&E services, for transportation of organs. For example, when organ donors transport, organs, the NHS department, which basically looks after that, sometimes might need to provision for, taking something across like blood or, various types of organs from a donor bank to a particular hospital for a patient to receive. So when we look at provisioning, it will also include things like transportation costs. And all this, when we look at from an overall perspective of how the government provisions for healthcare and healthcare related services, which could be any area that you think of within healthcare. So whether it's inpatient, outpatient care, what is inpatient care? Inpatient care when you are in the hospital, outpatient care when you're out of the hospital and within your home and you're still receiving care, a nurse visiting you or a healthcare worker visiting you to check on you, to help you with your daily course. Rehabilitation, if you had an accident or you had a fracture and some sort of rehabilitation has to happen because you might need physiotherapy sessions or need some sort of therapy session. It could be not just physical illness or let's say hurt that you've got. It could be mental illness, mental health care services, nursing services, medication that is prescribed, and sometimes even looking at remedies and aids which are provided to people to be able to help them recover independently from a particular illness. All these costs, including transportation, other areas of resource provisioning, all included would be looked at in the concept of what we say provisioning. So when we understand provisioning within this context, what we are looking at is healthcare provisioning in terms of how the government provides, for these services by allocating budgets, by allocating resources, manpower, and, some of the other related areas in terms of, maybe suppliers, new partners, new equipment will all be constituting what is called the provision. Now, the other thing that we want to also understand is what are the key values that we mean or, we need to look at. Say, for example, when we talk about, health and social care provision, and we talk about, person-centered approach. We talk about the 6 C's of care. We talk about integrated care being provided, to members of public or patients receiving, some sort of treatment within inpatient or outpatient. So within hospitals, outside hospitals. So in those cases, when we talk about these values, what we are looking at is the values which basically include things like individuality, independence, privacy, partnership, choice, respect and rights. These are the main values that we are going to be looking at when healthcare services are being provided to members of public. So if assuming I've had an accident and I'm receiving care at the hospital, I come from a certain background, certain culture, then what the healthcare staff or the nursing staff or the medical staff in terms of providing care for me would need to look into: who am I as an individual? What are my core values? What do I believe in? What is my cultural background? What are the various preferences that I have? And in some cases, one example could be I'm a vegetarian. So this preference would basically mean that I am having the ability to be able to choose my meals in terms of what I can eat and what I cannot eat. I can define this. I can discuss this with the nurse or the healthcare worker, and they would then accordingly provide me meals as and when they are required to be provided. It could also mean that sometimes in some cultures we have a bit of privacy in terms of when, for example, clothes have to be changed, or when you look at certain facilities which would require you to have a certain type of privacy, and that would be respected in terms of discussion. If you're not confident and comfortable with your conditions being discussed with somebody, then we would need to respect that, in the sense that I am going to, one, need permission from you, and second, I need to be able to then discuss it after your permission with any of your family members. And in some cases, if you do not want that to be done, then I will have to respect that this is something which is the patient's will, and obviously it can only be discussed with so and so. So when we talk about these core values, these 5 or 6 core values that we talk about, they are what are the core values that we get to see within health and social care in general, shown by employees or staff or members who work within this sector. And these values, if I am looking at, talking in context of care being provided, they sometimes are also called person-centered values. And these values tend to be these 6 values that we look at, that we have to adhere to when we look at, providing care or giving care to patients within this sector. Now, when we also look at some of the values which have then been incorporated into the NHS, the National Health Service. Now, these values further with these values which we talk about in terms of person-centered values, or PCA, which were introduced by Carl Rogers, who was an American psychologist, and then in the 60s it got introduced in America, and then obviously in the NHS in the early 2000s. And from then on, these have also been incorporated into what are called the NHS guiding principles of, the NHS Act of 2010. Now, these are 7 principles of NHS, which essentially are modeled on these, healthcare values which are prevalent within the sector. So they include comprehensive service. They also include things like, NHS care is predominantly based on clinical needs and not on the ability to be able to pay. So if I can't, I can't differentiate. NHS does not differentiate in terms of, I'm somebody who can afford private healthcare, or I'm somebody who cannot afford this. Care is given irrespective of your economic background, and it is provided to all members of the public in the UK, because it is one of the welfare benefits which Britain has, or as a state we have. Now, obviously, some of these values which people working with the NHS, so 280,000 people who work within the NHS, have been taught and trained on ensuring that when they deliver their services, when they work on a day-to-day basis, when they perform their job roles, they are showing these values and using these values to deliver the highest standard of service. Now, it also, goes to say without, it will be, say, for example, I would put it this way, that some of these values which have become now a part and parcel of the NHS Constitution and the NHS Act of 2010, they are non-negotiable. That means they go beyond boundaries. They are present when patients are being given care in the hospitals or outside in the community centers, or provisions which are created through local authorities, councils, and essentially voluntary organizations. And any such partner or voluntary organization which also works with the NHS they are expected to follow these core values, which are now the guiding principles of how the NHS actually works. And obviously, the NHS and the government is funded. Government is funding it, and the NHS is taxpayer funded. So in those cases, providing and adhering to these values is important and is a commitment which in the NHS as an employer seeks from anybody who works or decides to work within the setup. And at the end of the day, because NHS is a public sector, or organization which is owned by the government, so obviously they use taxpayers' money. It is funded through the taxpayer, so they are 100% accountable from a point of view of ensuring that maximum amount of value is delivered using the taxpayer money. And in this case, they have decided over the years that all types of care sometimes cannot be given more efficiently within the NHS. They have to work with the members of public, various communities, community groups, voluntary organizations, community centers, and obviously local authorities. And that is why the budget, for the NHS is now devolved. And in some cases, this is done, and the NHS services are provided through the primary care trusts, PCCTs as we call them, and they get funding from the local authorities. So in order to ensure that the best use of money is made, it is one of the guiding principles of NHS that along with the following of these six or seven values, what they also need to do is ensure that in places wherein, workings with the members of public, various communities, voluntary organizations, and family and members of the patients should be done in order to ensure it's providing value for money services at the end of the day for its, for its patients. Now, some of these guiding principles and values, when we look at NHS or National Health Service as an organization, are overarchingly these values. So these values have been taken from the NHS website. There's a link which I've included towards the end of the presentation in references. And should you wish to go and read individually about each of these values, then that can be done from the website. Now, these NHS values closely mirror the 6 values which are required to work within this sector and are a part and parcel of the person-centered approach. So working together for patients, this is something at an organizational perspective. So when we look at values or principles that we need to adhere to when we are providing care or services to individual patients, then it is being driven at the individual level. But what would be the extrapolation of those values at the organizational level is actually given here. So at the organizational level, when I say pan across the organization of NHS or National Health Service, you would generally see that they would work various departments of NHS, various organizations, trusts, various subsidiaries, or, the relationship it has with private players in the market. For example, it could be GP surgeries, it could be pharmacies, it could be community healthcare centers, local authorities, voluntary organizations. They are all looking at working together for the benefit of the patient. So one of the overarching values at the organizational level is working together. Then obviously they look at, respect and dignity. Again, at the organizational level, this is something then that cascades down into the organization at the individual level when you are providing service or, care to the patient. Commitment to the quality of care. So that means NHS as an organization is committed to ensuring that quality of care is being delivered. There are no compromises being done in terms of treatments being done or delivered or medication or any sort of service which the National Health Service provides that I can think of. They will have to adhere to certain quality standards which are set by CQC. And that is where the commitment to quality comes in at the organizational level. Obviously, as an organization, NHS looks at recruiting people who are compassionate. They are able to show empathy. They are able to understand the needs and requirements of the patient and the people coming in to take the service. So as an organization, NHS is overall considered to be compassionate as compared to some of the other businesses or other public sector organizations. What is the main aim of NHS? Or the National Health Service? The main aim of National Health Service is to improve lives. And, it needs to work and provide these services for everyone within the society. It cannot choose that it is going to just provide service to this particular member or that particular member. It has to be able to provision and provide these services to everyone living within the society or living within Britain. And that is where you would generally see that, the healthcare side of things, and when we look at values in particular of at the organizational level, they tend to be these six values which are reflected, on the NHS website. So if you have to read a bit more about this, I would suggest that if you go on to the slide 12 and you want to look at the principles that guide NHS, that is what I've given here. And this is what I've taken exactly from the website. I've not gone into details, I've just taken the headings, because what we want to understand in this case for this particular learning outcome is that how is the provisioning of healthcare services being done. So it starts with the provisioning. When we look at provisioning, starts with the definition of how the government looks at provisioning for all the health and social care services within the UK and for the members of public or within the society. What role does the NHS play? How these central values which are used to provide services in terms of patient services or medication services, or in terms of healthcare services, in terms of mental health services, whatever service we provide, what are the values which drive those services, how these values are married into the NHS, and then within the NHS, how they are driven at the organizational level is what we want to look at with a bit of understanding when we start this particular learning outcome. Now, what we also want to do is understand in terms of some of the assessment criteria. So one of the things that it talks about in the assessment criteria is discuss the values that underpin health and social care delivery within the NHS. So here is where what we are going to do is essentially go into, talking about these person-centered values in a bit more detail. And these person-centered values that we talk about in a bit more detail would typically be, the ones which form how the services are essentially delivered to members of public. So in this case, I have taken across these values in a bit more detail to ensure that it is done from a point of view of how NHS delivers, not an individual. It is not looking at why a healthcare worker would need to look at these values, or a nurse would need to look at this value, or a doctor or a dentist or a healthcare worker, whatever. No, it is at an organizational level. So at the organizational level, we are talking about equality. So when it talks about everyone counts, that means it is looking at equality, that these services are being provided to everyone in the society, everyone in the members of public, irrespective of their caste, color, religion, background, ethnic background, or where they come from. And that is related to the Equalities Act of 2010. Then when we go to these 6 C's in particular that we talk about, which is care, compassion, competence, communication, courage, and commitment, the 6 C's that we talk about, and then we relate them to how these values are central to working within health and social care, then these 6 C's, which are 6 C's of care, are the guiding principles which are used to provide person-centered care, which means you are receiving individualized, treatment. You're receiving treatment which is basically to which you are subscribed to. You are happy to, receive that treatment. It is being provided in because you made that choice that I want to undergo this treatment. The treatment, when it is being provided, it also takes into account your dignity, looks at respecting your beliefs and values, and then at the end of the day, it also respects what your rights are. So sometimes when we look at end of life care, and when people are diagnosed with terminal illness, say for example like cancer or any such other terminal illness, then in those cases, if the medication and the treatment being provided is not making any difference, sometimes you see that people, when they undergo surgery, they are put on life support systems. Now, if the life support systems are, there is always a dilemma in terms of understanding that, what is to be done if the patient stops responding or if the condition does not improve. Now, at that point in time, it relates to what is, I would say, dignity, is because the dignity of the, individual is to be respected from a point of view of understanding that, if we need to treat somebody, we need to treat them in a very dignified way, giving them respect and also in valuing their individuality. And that would mean that in some cases, we need to understand what are their ethical and moral beliefs. And this would then help us provide dignified care that is more open and obviously does so with a positive attitude when you are providing it to the patient. Now, sometimes you would also see that in some cases there is a dilemma that we would be faced with in terms of what is to be done, and that is where you then fall back onto the family members or the near dear ones to be able to explain the situation, and then obviously after explaining the situation, allow them to take a decision or make a decision in a way which they feel is going to be dignified for the patient. So here the concept of person-centered value or person-centered care is at the center or at the core of what is how the service is being delivered, and this would take into account individual preferences, their own individual circumstances, values, beliefs, their needs, and that is how the care would be then provided to the patient. We also look at some of the other values that we spoke about generally at the start of the session. So we need to look at respect, and one of the things that NHS is committed to is improving lives. So that means and quality of care. So when we look at these two, they relate to safety part of it. That any sort of treatment, any sort of medication, any sort of use of equipment which is being done is also going to be making sure that it is 100% safe to be able to use that and then use it to deliver services to the members of public. For example, the COVID vaccine. Now, it was given the approval by the MHRA before it was released and mass vaccination or, obviously vaccination of the members of public actually started. So it was tested out on about 30,000 people, and symptoms and, obviously side effects were noted. And then once it was cleared and, it went through these particular trials and everything came out fine, then and only then the safety standards were met. And then it was allowed to be rolled out in terms of mass vaccination. So when we look at, COVID, during the height of the COVID, Nadeem Zahawi, who was the vaccinations minister, went through this process with Matt Holgate, who was the health secretary at that point in time, to ensure that whether we use what vaccine we use, whether that vaccine has been appropriately tested and has that been certified by the MHRA, which is the central regulatory authority within the UK, which approves all medication use of all medication to the members of public. And this is to ensure that the treatment being provided is effective, it is safe, and it is does not pose any threat to the life of the individual when they are getting this particular treatment from within the NHS. One of the things you recall, I think some of you may recall, was that during the rollout of the vaccination, AstraZeneca's vaccine, started causing blood clots in certain members, and it led to about 8 or 9 deaths during the drive. And that is where a decision was taken to stop the use of that vaccine, because one of the things which it detected when these deaths happened was that some patients could, because of their conditions, could develop blood clots, and that could be fatal in terms of they losing their life. So we had 8 or 9, I think, and globally there were about 42, 43 such fatalities, if I remember correctly. And that is where, this vaccine was then, rollout of this particular vaccine was then stopped. And this was done in the essence that safe and effective, treatments can only be delivered from within the NHS. So we have to look at, these overall 6 values in particular, which basically underpin any sort of healthcare services which are provided from, the NHS or from any of the organizations which are dealing in providing these services to the members of public. And these values that we talk about in respect, partnership, dignity, individuality, independence, privacy, choice and rights, sometimes they are individually broken down into individual words, and they sometimes total up to about 8. But generally speaking, these are the 6 person-centered values. So sometimes when I write, I would say, I would use the word individuality and choice together. I might use independence and my rights together. In some cases, when we talk about privacy and we talk about respect, they can be used together. But generally speaking, if I have to look at all of these words independently, these are similar to the values, or basically are the same values that underpin the provision of services within health and social care. So whether I talk about them as two words or together, in some cases to reduce them to six, but they generally tend to be these ones which we have discussed, starting with individuality, choice, right, privacy, independence, dignity, respect, and then last but not the least, partnership. Because when we look at the concept of social and welfare provision in the 1970s and the early 80s, when it was integrated into the NHS for the delivery of services, that is where partnership was brought in, because partnership means local bodies, local authorities, voluntary organizations, charities, our councils, or any such provision, like which are basically pharmacies or any such provision which basically can be used to provide services of health and social care to members of public, would be termed under partnership. So when we work in partnership, or when you work in partnership, it involves working with you and your family along with some of the other health and social care staff, then this would be termed as partnership. And I gave an example in the class, earlier, was that my dad obviously had a fall, and, he bruised his knee very badly. And what happened was, obviously, if you look at the whole scheme of things in terms of how the services were delivered, at one point in time, we called the A&E. The A&E ambulance came in. He was on the first floor. So transportation down to the ground floor on a stretcher wasn't possible within the property. So one of the nurses helped him to basically get onto the floor. And then he struggled down the stairs one step at a time. Once he reached the ground floor, obviously, then he was put on a stretcher and he went into the A&E van, and from there to the hospital. In the hospital, he received care and treatment. There was a X-ray scan done, and obviously he was there in the hospital for 2 or 3 days. When he was released, he was given medication, and then because when he received medication, obviously, some part of the knee was still swollen, so it would have taken 3 to 4 weeks, the minimum time frame recommended for him to get back to the usual set of operations that he does. So he was given certain bits of, additional, let's say, help, which would be available to him when he was in the hospital and when he obviously came back home. So things like access to a wheelchair, a sofa, which could be a higher seating sofa than usual, because he wasn't allowed to bend his knees, a stool which he could use while he's using bathing and other, daily functions that he does. And then, the availability of crutches, so that he doesn't put extra pressure on his knee and on the one of the knees, which was bruised, right knee, and uses both the crutches to be able to walk and then exercise. And then one of the occupational therapists, which was a physiotherapy, sessions were also organized for him. Some of them initially happened in home, and then later on, when he could become a bit more mobile, some of them happened at the local community center or the provisioning through a partner, wherein he attended 1-hour sessions twice a week to be able to, get back his normal movements on his leg. So when you see the delivery of sofa, the wheelchair, the crutches, it happened from the council, and obviously it said property of the council. So here is where the partnership is seen to be working, because a healthcare worker is coming in every 2 days to, check on him, every 3 days to check on him. There was somebody coming in to make regular visits on a daily basis to help him with the daily course. And this is where we see the inpatient, which means in the hospital service and support, and outpatient when he's at home, dealing with us as family members, speaking to us, explaining the situation, and then the healthcare workers and various other personnel coming in to help, and the equipment and other things being provided, is all being done and delivered under the social and community welfare provision. And this is where we also see partnership happening. So there could be other organizations which are voluntary organizations providing access to wheelchair, crutches, and obviously once he got better, he returned some of this stuff gave a phone call, somebody came, collected it, took it back, and then it goes back into the inventory to be provided to somebody else who would need that in the future. So when we look at this whole process of how care was being provided in terms of when he was hospitalized and through the A&E, then hospitalization, and then release from the hospital back at home for the next 3-4 weeks to be able to help recover and get back to his normal condition. There were so many things and so many different types of people involved in providing those in providing these care services, and that was all underpinned by these 6 core values that we talk about: respect, partnership, dignity, independence, privacy, and choice while delivering this care to the patient. Is that understood? Any questions on this? Okay, so let's look at the second assessment criteria, which talks about identify and discuss the ethics that underpin health and social care delivery. Now, one of the things which I would do at some stage would be just to show that to you. At some stage, what I'm going to do is obviously provide a bit of a handout. Now, for some of you who want to look at understanding these values in a bit more detail, this particular handout is what I'm going to provide. And this particular handout would essentially talk about person-centered values in detail. And, they will define some of the things in terms of how these are provided, how they are delivered, and why it is required to ensure that we are able to deliver care with these values in taken into account or keeping them into mind in terms of when we are delivering these services as a person or as a let's say as a person working within the health and social care sector. So this handout would be something that you would look at, from a point of view of additional reading when it comes to, this learning outcome 3. Now, when we talk about the second assessment criteria in terms of identifying and discussing, the ethics which are required when we deliver these values, then when we talk about these, we are looking at basically, discussing about what are the ethical principles that guide the delivery of healthcare services within the NHS. So when we talk about these ethical principles which guide the delivery of healthcare services, this is what I'm referring to, the 7 principles, and they are basically now detailed out in terms of individual points. One of the key things that we look at within the NHS is that NHS works in an autonomous mode. That means there is perfect, there is no intervention from the government, but in cases sometimes at the policy level, they might be. Similarly, this is also then cascaded down into the way how these services are delivered to individuals to make sure that they are given all the information. They are sometimes, and what I mean by that is when they are given all the information, they have the independence to be able to make their own decisions. So in this case, an example that I would give you is that sometimes when you look at if a person is going, is to go undergo surgery. For example, if you have high cholesterol and you have blockage within one of your arteries, then in your heart, then you are required to undergo some sort of a surgical treatment. Now, even before this treatment happens, what you're going to do is you're going to have a consultation with the nurse, the clinical nurse. You'll have a consultation with your doctor. You'll have a consultation with your GP, and it'll go through a process wherein a lot of information is going to be provided to you in terms of what the surgery would involve, how the surgery would happen, how long will it take for you to recover, and why is it that at this stage only surgery is the right option rather than medication. So you will be getting all such information which will allow you to make an independent or an autonomous decision. That means something that you're going to decide on your own, and this will form the basis of treatment and care that you would receive, from the NHS. Now, this is also very clearly prevalent in the Mental Health Care or Mental Capacity Act. So when we talk about the Mental Capacity Act, what we are looking at is, in general, talking about, the purpose of this particular act was to allow for, to allow for the government to create a framework which could act and help in making decisions on behalf of adults who lack the capacity of making, independent decisions. That means because of maybe conditions or illnesses that they are incapacitated from being able to make an independent decision. So this particular act, Mental Capacity Act, was introduced by the government in 2005. And what this act basically means is that if a person is not able to make a decision, then in those cases, the 5 principles of mental health, Mental Capacity Act, which typically include things like presumption of capacity, includes things like what rights and what information has to be provided, how the decision can be termed as a wrong decision, and what is in the best interest of the patient when this decision is made, has to be done autonomously. That means the patient has to be able to do it autonomously. Now, in some cases, the patient is incapacitated. That means does not have the capacity to make the decision. Then this decision making is going to happen in conjunction with the family members of the individual. And this would then mean that they would be given the information. They would be given the pros and cons or ins and outs or disadvantages or advantages of the treatment or of the actions, and they would then be allowed to make an independent decision or autonomous decision in terms of how to go forward. And that would be one of the clear bits in terms of ethical principles that would need to be followed. Now, there's another term called beneficience. Now, have you come across this term, beneficience? In terms of what does it mean in the context of, just the literal meaning of the word. So beneficience, when we look at, is basically something which is related, and quite often used in the research ethics side. So here, what we generally mean is that when research is carried out, most researchers would essentially tell the participants, when medical research is carried out, when volunteers are asked to come in and join and take a part in some sort of testing activities, which are called clinical trials, then the term beneficience is used. So here, ethically, the researchers should then provide all the information to the research participants who are undergoing or will say yes to undergoing clinical trials, so that they are able to understand that this is the concept of how the trials will be run, and if the trials do not go as per what the stated outcomes are, then these could be the effects or consequences of undertaking that particular trial. So this bit that we look at in terms of the term beneficience basically is used to describe to the patients that if these are the dangers of maybe undertaking the clinical trials, these could be the possible side effects. So all the information essentially is provided in the interest that you are going to not cause any harm, or the patient's health would not be under any harm or any harm's way when they participate in these trials. So here you will have a moral responsibility to ensure that you are providing this information in the best interests of the patient, and it is to promote obviously the clinical trials and obviously some sort of well-being, because the test results would help in hopefully saving lives for a lot of people after these trials have been done. So one of the things that we look at in the NHS values and in the NHS constitution is that this principle is reflected in policies across the board, wherein NHS looks at very significantly at the rights and responsibilities of patients and healthcare professionals. That means it's staff that works within the organization, to ensure that they are not put in the harm's way when they are providing care. Now, an example here would be when you look at the COVID pandemic, a lot of health and social care workers actually also got infected, and there were a lot of loss of life within the community itself, in the sense the fraternity, not the community, the fraternity, which is some doctors, nurses, healthcare workers also lost their life while selflessly serving members of public during this COVID pandemic. Now, here, in some cases, the government is to blame because they've constituted a report which is going to now be a report undertaken by I think the government has constituted this report which is going to come out with the learnings or shortcomings of how this pandemic, how the government and the various government agencies dealt with the pandemic during the height of when it affected all sorts of people or all people within the country. So in this report, what they're going to try and come out with lessons which are going to be required to be learned for future such future instances. And here the concept would be to look at ensuring that the quality or the concept in the sense that this basically the welfare of the patient is to be protected, and what steps could have been taken ethically to address this particular let's say during this pandemic, this particular I'll use the word what I want to do is use the word in the sense that during this pandemic, the government could have actually taken certain steps which could have prevented loss of life. And ethically, it was a dilemma in terms of, for the government to say how much could they spend or what resources could they put in practice to be able to, look at minimizing the loss of life during the pandemic. So this would be something that we need to look at relating to ethical considerations in terms of when we look at specifically research which is carried out or clinical trials which are carried out, which are in the best interest of the patients and obviously to promote, long-term well-being within the members of public. Now, the beneficence is a word which basically looks at, as I put it this way, it will basically mean that what do we need to do by helping us create a bit of a framework, and that would essentially, be looking at beneficence. Now, there is an antonym or the opposite word of the word beneficence. So when we say beneficence, we are going to show mercy, charity, some sort of care, kindness that has to be done. But when we talk about malfeasance in terms of non-malfeasance, that is an exact opposite of the word beneficence. So here, what does this mean? This word would generally mean that when we talk about, committing harm, in a way, what malfeasance would mean that we are not looking at committing harm or not looking at committing, something which is going to harm the patient. So beneficence and malfeasance both is going to be looked at from a point of view of ensuring that when we look at ethical standards within the NHS, both have to be followed in order to ensure that best practices and best medication or best services are provided to patients, and it does not put them in their harm's way. It does not, it contributes to they getting better rather than contributing to their health deteriorating or their condition deteriorating. So is this okay? Is this understood, or do you want me to give you an example?
Please give an example, please.
Okay, so let's look at this in the context of nursing, right? So when we look at the context of nursing, if I talk about malfeasance in the context of nursing, what happens is if you see there are a lot of drugs or trials, clinical trials which take place. Now, these clinical trials which take place are taking place because the main objective is that we want to introduce new medication, new vaccination so that it can help cure diseases and obviously it can help save lives. But so what is the underlying principle here? That the underlying ethical principle here is that clinical trials which require volunteers are a bit of a necessary evil to be able to detect whether this medication or this equipment or this treatment is going to be beneficial or non-beneficial, or what side effects could this have for the patients, right? So although we are trying to do this trial, do these or ask for volunteers to participate in these trials from a good context, that we don't want anybody to come into the harm's way and that the medication that we are trialing would hopefully not cause any sort of serious, issues or health issues or any sort of side effects for the people or volunteers who are taking place in the trial. So in this case, the ethical side of things is to look at ethically we are and morally we are looking at doing this in the right context, but sometimes it can also create a different outcome wherein patients can suffer severe side effects or can even have loss of life because of reaction to certain medication to which they are participating in terms of this trial. So when we look at the beneficence of it, we are talking about that in general we are looking at taking these clinical trials in under and putting and asking for volunteers to come and participate in this research because we want to bring out better medication. Correct? Is that understood?
Yes.
And then is that understood? Yeah.
Yes.
Okay. Now, when we look at the reverse of it, which is non-maleficence, what we are looking at here is that this experiment that we carry out or the trials we carry out, which are ultimately looking at saving patients' life, can also sometimes affect the patients in the wrong way. That means it could be, having a side effect. It could maybe lead to, say, for example, a reaction which could maybe impair certain functions, or in some cases, pose more serious problems to the person who was healthy and fit. But because of the trials, the outcome of it has not come out positive, has led to some sort of a negative outcome. So in those cases, the Journal Medical Council would basically provision for, let's say, compensation. And this compensation would be provided for the rest of their life if they've had life, threatening, side effects. So, for example, if you want to participate in a particular trial and it does not go as per what was, planned, and the outcomes are not which were as planned, then in those cases, if the patients or volunteers suffer any side effects which could be with them for life, then in those cases, the General Medical Council would also provision for funds or compensation which will be provided along with the services which will be provided for the rest of their life. And this would be a case of what is called, malfeasance. Is that okay? So positive and the negative side. So when we talk about nursing in particular, nurses do not intentionally want to harm anybody. So, for example, if you're taking some blood samples, but if, sometimes in the morning when we go and take go for our blood samples, your veins are not clearly visible. So sometimes even after applying a bit of alcohol and, putting needles in through 3-4 times, it still does not draw blood. Now, the nurse is not doing this on purpose, right? It is the condition in the morning. Maybe you're feeling a bit cold, nerves are more contracted in the morning, and that is where it is. She's having difficulty or he's having difficulty to draw blood for the purposes of blood test. But the main intention here is to not harm you, but to get the samples as quickly as possible and to ensure that they are being taken with proper care so that you are not putting the patient at risk. Do you get that point? So that is the ethical consideration which the nurse would normally work with, and she would be looking at, taking this into account while, ensuring that she's still able to take the bloods, but you are also, not put in any harm's way, or, you don't feel the, stress or, pain in terms of when the blood is being taken out. So these are bits that we need to look at under ethics. Although I'm trying to give you a medication which is good for you and it will help you recover, but ethically, the medicine is a bit sour, or, is a very difficult medicine to take, but it's a necessary evil wherein I have to give this to you. So in those cases, the principles of beneficence and malfeasance come into play, because although you want the patient to feel comfortable, and we want to give you the best medication which is in your interest, but on the reverse side, this medication is a bit of a necessary evil and can cause some discomfort to you, but at the end of the day, it will help you get better. Is that okay? Is that understood? Now, what we also want to look at is some of the other ethical principles that have to be followed while we are delivering healthcare services, specifically from a community and a social welfare provision. We also look at the ethical principles of justice and confidentiality. Now, when we talk about justice, what we mean is that, irrespective of, again, looking into the Equalities Act, culture, background, values, beliefs that you are going to provide them the same type of service without any differentiation in terms of considering their background, culture, values, and beliefs. So here, the healthcare professionals are expected to, keep this in regard, that when they give or provide services, it is also matching up with the NHS value of ensuring that NHS provides, services to each and everyone, which would help in improving, their lives. And last but not the least, when we talk about confidentiality, what we are looking at here is the aspect of data protection. That means, you're sharing information only if it is, let's say, okayed by the patient, only if the patient about which the information is being shared is happy for you to divulge or disclose that information. And the other bit that we also look at in mind is that when you get access to information of the patient, the access to information is driven by access rights. If you are not required to, get hold of that information, you should not be having access to that information. It should not be used by insurance companies to drive up medical insurance premiums just because you have an underlying condition. So unlike in the States, wherein your insurance policy, healthcare insurance premium policy, or your policy premiums can actually go up if you develop a heart condition, or if you have a type 2 diabetes, or if you have certain types of conditions. And this data is shared transparently by the medics, and the various organizations or institutions in the US. Here in the UK, this does not happen. The data, which your GP has, or the data which your, say, for example, the surgery has, where you are locally registered, does not share this with outside agencies for the purposes of any sort of, benefits or any sort of, financial gains. So when we talk about the principles of confidentiality, what we also expect here is that when we look at ethics, all healthcare professionals are sworn to protect privacy and confidentiality of the patient's personal and medical information. So it should not fall into wrong hands. And this is covered under the confidentiality clause of it. And specifically, if we look at, this will be covered under what is called the Data Protection Act with regards to, the Act of 2018. Obviously, previously it was the Data Protection Act. And then later on, it was revised with GDPR, which included Journal Data Protection Guidelines in terms of how the data is stored, used, retrieved, and who has access to that particular data. Because when the Data Protection Act was introduced in 1998, obviously the internet was not prevalent. Data was not stored electronically. Most of the data was on paper records or in records within various places. But with the proliferation of the internet, and now data being stored on the cloud in places which is outside sometimes the control of the National Health Service and various agencies. Then also this GDPR, which was the amendment to the Act introduced in 2016, and then 2 years were given to all organizations to comply with this. Now is called the Data Protection Act of 2018, because a lot of data now, or when I say lot, I don't know the percentage, but a lot of it is now currently stored online and or is stored in PC servers and cloud systems. So here the information should not fall into the wrong hands, and that is where the government introduced the Journal Data Protection Guidelines, GDPR, to ensure that when data is stored online, it can be stored online for a maximum of 6 years. In certain cases, if certain organizations have to store the data for a longer time, then they need to seek permission from the person so that they can store that data. that data, how is it stored, retrieved, who has access to it, and then where is it stored is something which needs to be regulated, and that is what is regulated under the new amendment of the Data Protection Act of 2018. So all of us which are in Europe, any such organization, like for example Facebook, or you look at LinkedIn, or you look at any such social media organization, or any such organization wherein you have subscribed to and have agreed to let your data in terms of your information like name, address, email, phone number, date of birth being stored, cannot be stored in servers outside the EU. They have to be stored within the EU. So when this introduction was done, Facebook, for example, a lot of us use Facebook, or we use Instagram or Twitter. These companies store the data centrally in data warehouses or data servers, which could be anywhere outside the European Union or in the US. So this data protection regulation, when it was implemented by EU in 2016, allowed these companies 2 years time frame to be able to store everything and migrate everything with regards to the European Union, citizens, to have the data stored within EU. It cannot be stored outside or in servers outside the EU. So this is a very important part of the amendment which was introduced as GDPR, General Data Protection Regulation. And most countries, in our case in the UK, we amended the Data Protection Act of 1998. And this was then updated to the Data Protection Act of 2018. Is that okay? Any questions on this? Okay, so this part of the assessment criteria looks at how the ethical principles underpin the provision of these, when I say social and healthcare services in the UK, and they reflect on what is required to be adhered to in terms of guidelines, regulation by healthcare professionals or people who work within this sector, to ensure that the ethical side of things related to autonomy, beneficence, justice, confidentiality, and non-maleficence are used and are enacted in while they are delivering their services to the members of public. And this is very important, because if the information falls into the wrong hands, then what we can generally get to see is that it can be used for various different purposes. And in those cases, what you would generally see is that this data can be used for commercial or beneficial purposes by anyone which gets access to it. And that is where the idea is to restrict the access by following these ethical and moral principles which have to be used in order to protect the individual's privacy, dignity, and independence, and obviously their data. Okay, so with this, we come to the end of this particular learning outcome, wherein we wanted to understand the concept of provision, and provision with relation to values, principles, which are related to the delivery of health and social care services to the members of public within by the National Health Service and associated agencies and bodies. So any questions on today's discussion? Right. So if there are any questions that you think of, then what we are going to do is, I'm going to end this session. You can send in the questions via email. If not, then we will pick them up tomorrow. Now, tomorrow, what we're going to do is basically do the discussion on the assignment for this particular unit. And this session, I am looking at doing it at 4 p.m., which is the time that we had agreed to earlier. So I'll send you the invite just after the presentation and this session when it concludes, so that we can then do the discussion on the assignment brief for how to put together the evidence for this particular assignment. So I will see you guys tomorrow. Until then, if you think of anything, if you need anything, do drop me an email and I'll come back to you with more information.
Do we have class tomorrow, Rama?
Tomorrow at 4 p.m.
Oh.
Okay, thanks.
Please, this link, can you send it to us?
Yes, I will send the link over. And this link is something that you can get from the YouTube channel straight away, because the idea was this is now on the YouTube channel, and there is something that you can refer to if you want to, at any given stage on the on YouTube. So definitely it is available.
Okay, thank you.
Okay, thank you. Bye.
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 So this is here under the live part, which is this particular video. So when you click on this, you'll be able to see social and community welfare provision learning outcome 3.
Okay.
Thank you. Bye for now.